Welcome to the deep dive. Today we're really getting into Autism Spectrum Disorder, ASD. It's a topic that, well, it touches a lot of lives, but often feels quite complex.
It really does.
We've gathered information from, various reliable places, health organizations, research groups, even digging into Wikipedia to try and get a clearer picture of what ASD actually is.
And it's probably good to say right off the bat, it's complicated. And it's called a spectrum for a reason.
Right.
It looks very different from person to person. There's no single autism.
Exactly. So our aim today is to provide a clear, informative overview, maybe clear up some common myths, and highlight the key things you need to know for better understanding. Okay, so let's dive in. Fundamentally, what is autism spectrum disorder?
Okay, so at its core, ASD is what we call a neurodevelopmental condition. That basically means it relates to how the brain develops and functions.
Yeah.
And specifically, it affects how people interact with each other, how they communicate, how they learn, how they behave. These sort of differences in brain function really shape those social interactions and behaviors.
Mm-hmm.
And a key point is that it usually shows up before a child turns 3. And it's lifelong. It's part of who they are.
And that word spectrum, it's so crucial, isn't it? It really tells you it's not just one thing.
Precisely. Yeah, the whole idea of a spectrum highlights this huge range of traits and, the different levels of support someone might need. The term spectrum actually now includes conditions that used to be diagnosed separately, like what was called autism, Asperger's syndrome, childhood disintegrative disorder, and PDD-NOS, pervasive developmental disorder, not otherwise specified. You still hear Asperger's syndrome sometimes, and it's often thought of as being maybe on the milder end of the spectrum, especially regarding outward communication differences.
Gotcha. So where do these differences typically show up? What are the main areas?
Well, there are a few core areas. One really big one is communication and social interaction.
Okay.
So individuals with ASD might find it harder to understand what other people are thinking or feeling. They might also have challenges expressing themselves, both with words and, non-verbally.
Like gestures and expressions.
Exactly. Gestures, facial expressions, even how they interpret touch. Sometimes there can be a bit of social naivety, maybe a less intuitive grasp of body language or those unspoken social rules.
Mm-hmm.
This can make things like social reciprocity, that sort of backing forth in conversations, tricky. And even understanding things like, say, sarcasm.
That paints a clear picture. What about other kinds of behaviors?
Yeah, another key area is what's often called restricted and repetitive behaviors or interests.
Okay.
You might hear the term stimming.
Yeah, I've heard that.
That often falls under this category. It can be repetitive movements or sounds or speech patterns. It often helps people regulate themselves, maybe process sensory input or manage feelings.
Wow.
And then there's learning and development. People with ASD often have what's called an uneven skill profile, meaning they might be incredibly strong in one area, like maybe analytical skills or memory, but face real challenges in another, like communication.
Right.
And finally, sensory input. Reactions to sounds, lights, textures, smells, they can be really distinct, sometimes very intense, either hypersensitive or hyposensitive.
Now, this is where I think things get really interesting. I've been reading about how our sort of traditional view of these social differences might be shifting a bit.
That's right. Yeah, there's definitely a move to look at it differently, especially the social communication piece. There's this idea called the double empathy problem.
Okay, tell me about that.
Well, it suggests that maybe the difficulty isn't just one-sided, like the autistic person struggling to understand the non-autistic person. It might be a mutual lack of understanding.
Two-way street.
Exactly, between autistic and non-autistic ways of experiencing and communicating the world. So it challenges that old idea that the deficit is solely within the autistic person.
That really reframes it.
It does. And it suggests maybe non-autistic people also need to learn how to bridge that communication gap. And related to this, autistic people often develop ways to cope, sometimes called masking.
Masking.
Yeah, consciously or unconsciously trying to hide autistic traits to fit in or appear more neurotypical. While it can be a survival strategy, it can be absolutely exhausting and really bad for mental health.
I can imagine.
And it can also delay diagnosis, meaning people might not get the support they need until much later.
Let's dig a bit more into those communication differences. You mentioned uneven language development earlier.
Yes, and this is incredibly varied. Some autistic individuals might develop language later than typical, or maybe not develop spoken language at all. That's sometimes called non-speaking autism.
Okay.
But then on the other hand, you might have hyperlexia. An ability to read, often self-taught at a very early age, sometimes even before they start school, but maybe without the same level of comprehension.
Wow.
And even in infancy, a subtle difference might be less joint attention, that shared focus, like when a baby points at something and the caregiver looks too.
So these are things parents might pick up on early.
Potentially, yes. Things like later babbling, maybe using gestures in unusual ways, not responding as much to their name, or vocal patterns that don't quite sync up with the caregiver.
Yeah.
As they get a bit older, maybe less variety in their babbling, fewer different sounds or words, fewer word combinations. Their gestures might not always match their words.
I see.
And they might be less likely to say, point something out just to share the experience or make requests in the same way. And you might see more echolalia.
Repeating things.
Yeah, repeating words or phrases they've heard. Estimates vary, but maybe around 40% of autistic children don't develop functional spoken language. And for those who do, their verbal skills in adulthood often relate back to how language developed early on.
That's really helpful context. Now, you mentioned ASD is complex. Does it often appear alongside other conditions?
Yes, co-occurring conditions are actually quite common. ADHD is a big one.
Attention deficit hyperactivity disorder.
Right. Estimates suggest maybe 25% to 32% of autistic people also have ADHD. Epilepsy is another one, around 10%.
Sure.
And that risk can increase with age and also if there's an intellectual disability present.
And intellectual disability itself.
That co-occurs in a significant number, maybe 30% to 40%, though that percentage might be decreasing a bit as diagnostic criteria broaden and capture more people without intellectual disability.
That's still a high overlap. What about mental health?
Very common too. Anxiety disorders, somewhere between, say, 17% and 23% overall. Depression is also a major concern, affecting maybe 9% to 13% generally, but that number jumps to around 40% for autistic adults.
Wow.
OCD, obsessive compulsive disorder, is seen in maybe 7% to 10%. And there can sometimes be overlapping traits with schizoid personality disorder, particularly in some people previously diagnosed with Asperger's.
Are there physical health connections too?
Yes. Definitely. Genetic conditions are linked in about 10% to 15% of cases. Tuberous sclerosis is one example found in maybe 1% and 4% of autistic people.
Okay.
Gastrointestinal problems, stomach issues, digestion are really common and seem linked to other difficulties. Sleep problems are huge, affecting maybe 2/3 of autistic people.
That must be tough.
Absolutely. And motor difficulties, things like low muscle tone, trouble planning movements, walking on toes, maybe dyspraxia, even joint hypermobility, sometimes linked to Ehlers-Danlos syndromes. And there was a Danish study suggesting a higher risk for a wider range of physical diseases too. Oh, and there's some tentative evidence suggesting a higher likelihood of experiencing gender dysphoria.
That's a really broad range of potential co-occurrences. Are there also sometimes unique abilities or strengths associated with autism?
Absolutely. That's really important too. Many autistic individuals have unusual abilities, sometimes called splinter skills. These can range from really deep knowledge in specific areas to more pronounced savant talents in things like math, music, or art. Some research even points to superior skills in perception and attention for certain tasks. We often hear about a spiky skills profile.
Spiky.
Yeah, like really strong abilities in some areas right alongside areas of significant challenge. We mentioned motor signs already. They're common. Pathological demand avoidance, or PDA.
What's that?
It's characterized by a really strong resistance to everyday demands and requests, often driven by anxiety. Unusual eating behaviors are also common in kids. Maybe 3/4 show things like extreme selectivity, specific rituals around food or food refusal.
Right.
And there's some emerging research looking at moderate links between autism and problematic internet use or gaming disorder.
It really drives home how diverse autism is. Let's shift gears now to causes. What do we actually know and maybe what don't we know?
This is so crucial. The main thing to stress is that the exact causes are still mostly unknown. But the overwhelming scientific consensus is that genetics play the biggest part.
Right.
Autism is considered highly heritable, and it's polygenic.
Meaning many genes.
Exactly. Not just one gene, but likely many different genes interacting in complex ways, each contributing a small amount to the likelihood.
And environmental factors. Do they play a role?
They seem to play a smaller role and mostly seem relevant during pregnancy prenatally.
Like what kind of factors?
Things like advanced parental age, certain health conditions the mother might have during pregnancy, exposure to specific medications like Valproate, maybe even high levels of air pollution are being studied. But, and this is absolutely critical to repeat, vaccines do not cause autism.
Right. MMR, thimerosal.
None of them. That link has been thoroughly, extensively debunked by science. And neither does bad parenting. That's another harmful myth.
So important to keep stating that clearly. Okay, so if the causes aren't fully mapped out, how is autism actually diagnosed?
Diagnosis is based on looking at behavior and development. It's not a medical test.
Right.
For children, it's often a two-stage process. First, there are developmental screenings during regular checkups.
Like at the pediatrician's office.
Exactly. Usually around 9, 18, and 24 or 30 months. They look at milestones, learning, language, movement, behavior. Pediatricians often do specific autism screenings at the 18 and 24-month visits.
And those screenings raise a flag.
Then the next step is a more comprehensive evaluation by specialists. This might be a child psychologist, a developmental behavioral pediatrician, maybe a neurologist.
What does that involve?
It involves detailed questions about the child's history, their development, behavior, communication. There will be tests looking at cognitive skills, language, adaptive skills like self-help skills, and crucially, direct observation of the child's behavior.
Okay.
Speech therapists, occupational therapists might also contribute. They might recommend hearing or vision tests, sometimes genetic testing, just to rule out other things.
And for adults who maybe weren't diagnosed as kids?
If an adult recognizes autistic traits in themselves, the first step is usually talking to their doctor, who can then refer them to a specialist, like a psychologist or a psychiatrist experienced in adult autism assessment.
And are there official criteria they use?
Yes, the main diagnostic manuals, the DSM-5-TR, are used mostly in the US, and the ICD-11, used internationally, have specific criteria.
And what do they focus on?
They both focus on two core areas. First, persistent deficits in social communication and social interaction. And second, restricted, repetitive patterns of behavior, interests, or activities.
Okay.
And these characteristics need to have been present from early childhood, even if they weren't obvious then, and they need to significantly impact daily functioning. And as we said, currently no known biomarkers, no blood tests, no brain scan can definitively diagnose it.
So it really comes down to clinical expertise, observation, and history. Okay, so once someone has a diagnosis, what happens next? What about interventions or support?
Right. First thing to say, there's no known cure for autism. And actually, many people in the autistic community strongly oppose the idea of seeking one.
That's an important point.
Yeah. So interventions aren't about curing, they're about supporting development and helping individuals gain skills, maybe self-care, social skills, communication, managing sensory sensitivities.
What kind of therapies are common?
Things like speech therapy, occupational therapy are very common. And then there's applied behavior analysis, or ABA.
Right. ABA comes up a lot. What is it exactly, and is it controversial?
It is, yeah. ABA is a type of therapy based on behaviorist principles. It uses reinforcement to teach specific skills and behaviors.
Okay.
It's widely used, and some organizations endorse it. However, it's also faced significant criticism, especially from neurodiversity advocates.
Why is that?
The main criticism is that it can focus too much on making autistic individuals appear normal or neurotypical, rather than accepting and supporting their autistic ways of being. Some people report negative or even traumatic experiences with older forms of ABA, and organizations like NICE in the UK have noted a lack of strong evidence for its overall effectiveness for core autism characteristics. So it's definitely something with ongoing debate.
That really highlights the need for personalized approaches, doesn't it? What other kinds of support are helpful?
Absolutely. Beyond specific therapies, focusing on the environment is huge. Reducing barriers, social barriers, sensory barriers can make a massive difference in participation in education and employment.
Okay.
Medications might be used, but they treat co-occurring conditions like anxiety or ADHD, not autism itself. In schools, there's the SPACE framework. Yeah, it stands for sensory, predictability, acceptance, communication, empathy. It's a way to think about making classrooms more accessible. Things like inclusive education models and universal design for learning also aim to create environments that work for everyone, including autistic students.
But school isn't always easy for autistic kids, right?
No, unfortunately not. They can face big challenges, sensory overload from noisy classrooms, social anxiety, bullying is sadly common. This can sometimes lead to what's called emotionally based school non-attendance.
And what about employment?
Similar challenges can arise. Traditional interviews can be difficult, navigating unspoken workplace social rules, sensory sensitivities in open-plan offices, needing clear communication styles.
So what helps? It sounds like creating supportive environments is just crucial. Now, we absolutely have to talk about something really serious. These supposed cures that sometimes get promoted.
Yes, vitally important. Let's be crystal clear. There is no cure for autism. Anyone promoting a cure is likely selling something ineffective and potentially dangerous.
What kind of things should people watch out for?
There's a whole list of unproven, often harmful things that have been marketed. Things like raw camel's milk, GCM-AF injections, something called cease therapy, which claims to detox vaccines.
Oh dear.
Chlorine dioxide, which is essentially industrial bleach, also called MMS. Certain supplements pushed as miracle cures, secretin hormone injections, chelation therapy to remove heavy metals, all unproven and potentially very harmful.
That sounds terrifying. What are the red flags? How can you spot a fake treatment?
Be extremely skeptical of anything claiming to be a cure or a miracle. If it sounds too good to be true, it probably is. Other signs: treatments not mentioned by reputable health organizations, very high costs, promises of instant results, relying only on personal stories instead of scientific evidence, saying anyone can administer it without training, or claiming to treat loads of unrelated conditions.
Okay, good warnings. What about special diets? Like gluten-free, casein-free?
That's another area where caution is needed. While some families try these diets, the current scientific evidence just doesn't support them as a standard treatment for autism itself.
Right.
Studies showing benefits often have flaws, like small numbers or placebo effects. Plus, restrictive diets can carry nutritional risks, especially for kids who might already be selective eaters.
So what's the advice?
If there are genuine digestive issues or suspected food allergies, which can be common in autism, then definitely talk to a doctor and a registered dietitian. Get proper assessment and personalized advice. Don't just cut out major food groups based on unproven theories.
Makes sense.
Same goes for supplements. While some autistic people might have lower levels of certain vitamins, taking megadoses of things like vitamin B or magnesium isn't recommended without medical advice and can even be harmful.
This is such critical information. Let's shift now to how society thinks about autism and this idea of neurodiversity.
Right, the neurodiversity paradigm is a really important shift. It basically views autism not as a disorder to be fixed, but as a natural, healthy variation in the human brain.
A different way of being wired.
Exactly. It's strongly supported by the autism rights movement. Now, it's fair to say there's still debate about this perspective among different groups, autistic people themselves, families, professionals, but we are seeing a definite trend toward using less pathologizing language.
Like saying characteristics instead of symptoms.
Precisely. Focusing on differences rather than just deficits.
And it feels like general awareness of autism has grown hugely, hasn't it? We hear about rising prevalence rates.
Absolutely. Those estimates have gone up significantly since the 90s. Most experts believe this is mainly due to better awareness and broader diagnostic criteria. We're better at recognizing autism now across a wider range of presentation.
So not necessarily more autism, but better identification.
That's thought to be the main driver, although a true increase can't be entirely ruled out. The WHO estimated about 1 in 100 children globally between 2012-2021, with a rising trend. And CDC data in the US shows similar increases.
Okay.
But again, it's crucial to remember this rise has been wrongly linked to vaccines by anti-vaccine activists, despite the science clearly showing no connection.
Right. And this growing awareness has also fueled an autistic culture and advocacy.
Yes, very much so. There's a strong sense of autistic identity and community now, movements advocating for acceptance and accommodation rather than searching for a cure. You see events like World Autism Acceptance Day, which importantly shifted from Awareness Day, Autistic Pride Day, conferences like A Treat run by autistic people, and we see more successful autistic individuals speaking out, like Greta Thunberg, who frames her autism as a strength.
That's a powerful shift. But there's still discussion within the community about difference versus disability, isn't there?
Yes, it's a really nuanced conversation.
Right.
While neurodiversity emphasizes accepting difference, it's also undeniable that for many autistic people, their differences do result in significant disability, especially in a world not designed for them. They need and deserve substantial support.
So it's not necessarily either.
Exactly. It can be both a different neurotype and a disabling condition depending on the person and the context. Acceptance doesn't mean ignoring the challenges or the need for support.
Understood. And finally, are there known links between autism and other aspects of identity?
Yeah, some interesting findings here. Research suggests autistic people are significantly more likely to identify as LGBTQ plus main and also as non-religious compared to the general population. There's also much more awareness now about potential gender differences. Autism might present differently in women and girls, which could explain why they've historically been underdiagnosed or misdiagnosed. The criteria were often based on male presentations.
Right.
And sadly, there are also significant racial and ethnic disparities. People from minority backgrounds often face more barriers in getting diagnosed and accessing resources.
That's vital to acknowledge. Before we wrap up, just out of curiosity, where did the word autism come from?
Interesting story. The term autism actually comes from the German autismus. It was first used way back in 1912 by a Swiss psychiatrist, Paul Bleuler.
Okay.
But he used it differently in the context of schizophrenia to describe a kind of withdrawal into oneself. It comes from the Greek word autos, meaning self. But then in the 1920s, a Soviet psychiatrist, Grunya Sukareva, used the term to describe children with traits much closer to our modern understanding of autism. So she really used it in the sense we recognize today, much earlier than others who often get the credit.
Fascinating bit of history. Okay, so to try and pull this all together from our deep dive, autism spectrum disorder is, well, it's complex. It's a neurodevelopmental condition, a different way the brain is wired, with a huge range of presentations. Definitely not caused by vaccines or parenting. Genetics seem to be the major factor, maybe some prenatal environmental influences. And it involves core differences in social interaction, communication, behavior patterns, and sensory processing.
And I think the key takeaway is the importance of both understanding and acceptance, embracing neurodiversity, while also recognizing that many autistic individuals face real challenges and need access to effective support.
Absolutely. If you want to learn more, please do check out the reliable sources we use today, and we'll leave you with this to think about. As our understanding of autism evolves, and as the neurodiversity movement gains strength, how do our societal structures, our schools, workplaces, healthcare systems, need to fundamentally change to truly include, support, and value autistic people and the unique perspectives they bring?
A really important question.
Thanks for joining us for this deep dive.